So this is chronic renal failure. Remember, there's two types of renal failures. There's the acute kidney injury, which is, we used to call that acute kidney failure, and now we have chronic renal failure. And this is due to the kidney basically losing pretty much permanently losing its function, okay? Remember, the acute one, it's reversible. You have, let's say you have ATN, you get damage to the tubular cells, but 2 to 3 weeks later, hopefully your tubular cells can regenerate, and you go back to at least normal function, or close to normal function. Here your kidney stops working. And the etiologies are just damage to the kidneys, damage to the glomerulus, to the tubules. You can have inflammation. Or you can have vascular problems, okay? Vascular problems still also lead to damage to the kidney because the blood needs to perfuse the kidney. Now, the very most common causes of chronic renal failure are diabetes mellitus, hypertension, and glomerular disease. So diabetes mellitus causes vascular problems, non-enzymatic glycosylation. It also causes just damage to the tubules because there's that increased filtration pressure because it causes glycosylation more in the efferent arteriole. So you cause increased pressures, and then you can damage the kidney, including the glomerulus. And remember, we said we also even see the nephrotic syndrome there, where diabetes mellitus can cause a nephrotic syndrome. Hypertension just causes increased pressure and causes damage to the glomerulus, tubules. Glomerular disease we talked about a lot. And I really like this disease. I don't like it, but I think it's elegant, at least pathologically, in your mind, because it sums up a lot of things. It sums up, if you understand the normal renal function, you can understand all the clinical features. So what were the normal functions of the kidney? First of all, number one was filtration. So to get rid of fluid, to get rid of waste, and to maintain the correct amount of body fluid, maintain homeostasis of body volume. Number two was for hormone production, okay? Remember, the kidney was involved in the production of various hormones. So now we're going to see the problems when these things don't happen, because this is the kidney failure, so it stops doing filtration, it stops doing hormone production. So one, we're looking at filtration problems now. One, if you can't filter, you're not, remember in the collecting ducts, this again, we see this again, see H plus, K plus. This does not happen. This sodium reabsorption, H plus secretion, K plus secretion. Okay, this does not happen. Okay, oops. Does not happen. What do you get? You get too much potassium, too much acid in the blood. You get hyperkalemia, metabolic acidosis. Okay. The other thing you don't do is you don't even filter water and sodium into the tubules as well as before. If they're not getting filtered into the kidneys, they're just going to stay in the blood, and then you're going to get retention of sodium and thus retention of water. And this you can get edema. It can be not good. Okay, you're not filtering, you're not excreting. Finally, we have uremia. Remember, this is the buildup of the nitrogenous waste products. And there's going to be many symptoms. We're going to talk about that in a second. So again, decline in function and filtration causes poor filtration of sodium and water, causes this hyperkalemia and metabolic acidosis because you fail to excrete them into the tubules, and then you get buildup of the uremia. Again, you're not filtering out the nitrogenous waste products. Now, if we have hormonal problems, the kidney's not making the hormones that it usually does. You get anemia. What was the hormone that the kidney makes that helps prevent this? Remember, the kidney normally makes EPO. So if you don't get EPO, you get anemia because EPO stimulates red blood cell production in the bone marrow. Next, you get renal osteodystrophy. Why is this? What did the kidney do that has to do with calcium? Remember, the kidney activates vitamin D. Okay, so if you don't get activated vitamin D, you get reduced calcium levels, so you get low calcium. I don't know why that keeps happening. Decreased calcium. What is going to happen in response to decreased calcium? Well, now you're going to get PTH activation. PTH will go to the bone, and it's going to cause bone resorption, okay? It's going to cause bone resorption in order to increase the calcium. But when you're going to increase bone resorption, you're going to weaken the bone, and that's why you get a renal osteodystrophy, okay? So, filtration problems, hormonal problems from chronic renal failure. Now let's talk about uremia a little bit. This is the buildup of nitrogenous waste products that we can think of interchangeably as urea, because urea is carrying all those nitrogenous waste products. And this is, we build up because the kidney fails to filter and excrete them. And the clinical features are going to be here. So some GI symptoms and nausea, loss of appetite. You just don't feel good when you have a bunch of waste in your body. And then these ones you just kind of have to memorize. You can have heart problems. You can have heart inflammation. These waste products go to the heart and they cause inflammation. You can have platelet dysfunction. This urea prevents the platelets from working and preventing, basically helping blood coagulation. And finally, we have encephalopathy with Asterixis, because that buildup of nitrogenous waste products can go into the brain and cause altered mental status. Your brain doesn't work as well, and you get the Asterixis. Remember what that was? Remember that was the flappy. We see that in cirrhosis as well, where their hands get a little flappy, and that's all because of that uremia. Okay, so that's it for chronic renal failure.